November is National Hospice and Palliative Care Month. Here to help us take a closer look at these essential services is Dr. Christina McDaniel, Executive Director for Palliative Care at MUSC Health, and Dr. Kathleen Lindell, Mary Swain Endowed Chair in Palliative Care Health and Associate Professor at MUSC College of Nursing. Ladies, thank you so much for being here with us today. And Dr. McDaniel, it's come to my knowledge that people often confuse these two or think that they're one and the same when we're talking about palliative care and hospice care. Can you explain the difference?
Absolutely, yes. It's a big misnomer for people out in the community as well as other healthcare providers to think that palliative care and hospice are synonymous, that they're the same thing, when actually I love to explain palliative care in that it is not based on prognosis. It's really based on the need of the patient and family that are dealing with serious illness. So when we think about all of these illness that patients and families can be suffering from, dealing with symptom burden, that really is the focus of palliative care. How do we improve their quality of life? And hospice is a portion of that, but there's a more distinct time period that's associated with hospice. So many times when you think of a hospice patient, you think of someone who maybe curative or disease modifying therapies are no longer effective for them, and they've entered this phase that's considered terminal.
Okay. And when we're talking about improving the quality of life with palliative care specifically, what does that look like? I'm sure it, it caters to the needs of each individual, but what does that look like in palliative care?
So we like to think of it, it's an extra layer of support to the care that patients should already be seeing. So as Christina mentioned, that symptom burden is a big problem for patients. And I'll give an example. Patients who have advanced lung disease, such as COPD or other lung diseases, they might have difficulty breathing, they might have a lot of cough, they might be anxious and depressed because they're afraid. Mm-hmm. And so there are both non-pharmacologic and pharmacologic, meaning that there are therapies that don't include medicines, and then there are medicines that can help control these symptoms and actually help them to have a better quality of life.
Yeah. And Dr. McDaniel, I want to talk about hospice care. I would imagine that a lot of families struggle with kind of accepting that it's time for their loved one to go into hospice care, to have hospice care. So what role does communication play in that process?
Oh gosh, I think communication is probably at the center of everything that we do in hospice and palliative care. Difficult conversations are just that. They're difficult. They're hard to have. Unfortunately, patients and families are going to experience end of life. And so, I think being able to adequately communicate what is it that hospice is going to bring to that patient and to that family, how is that care model going to help to improve their quality of life in the time that they have left, because I think that's the most important thing. We may not be able to change the ultimate outcome, but what we can change is what does it look like in between. And so that's the biggest part of the focus.
Yeah. Dr. Lindell, there is a third annual MUSC Palliative Care Showcase coming up tomorrow. Can you tell us about this?
Yes, so one of the things that we do at MUSC College of Nursing and in conjunction with our partners in the palliative care program is we work to educate all students across the interprofessional system. So nurses, doctors, social workers, occupational therapists, dentists, anyone in health care professions. And so what the focus of the Palliative Care Showcase, this year it's going to be on interprofessional palliative care education. And so what we want to do is we'll showcase the great work that's already being done at MUSC. We will have speakers from across the College of Nursing, the College of Health Professions, the MUSC Palliative Care Program, and the Center for Healthy Aging to share what's being done.
For more information on palliative care and hospice care and also this wonderful showcase, you can go to nursing.musc.edu. Dr. McDaniel, Dr. Lindell, thank you so much for being here with us today.
Thank you so much.
We're back in 2 minutes.